The Prime Minister says the NHS must reform or die. Sir Keir Starmer will set out a long-term plan later this morning to overhaul the National Health Service.
Well, this damning report from Lord Darcy says huge waiting lists and high cancer death rates have plunged the NHS into a critical condition. It was commissioned by the Health Secretary, Wes Streeting.
And Wes Streeting joins us now from Westminister. Good morning, Mr Streeting. Just to start by talking about the Darcy report and money. He is very clear that reform is needed, but also there's big funding gaps. The independent think tank, the Health Foundation, say the gap is £38 billion a year. That's the shortfall in funding every year for the National Health Service. We know the Treasury, for the spending review, is currently asking all departments to find cuts in their budgets. Is the National Health Service budget exempt from that cuts process?
No, we're taking a tough look right across the public finances because, you know, Darcy says two things. On one hand, we've had more than a decade of underinvestment, particularly on the tech and the capital side, which has led to ballooning day-to-day pressures, which then mean you raid the tech and capital budgets to plug day-to-day pressures. And so the vicious cycle continues. And also that money that has gone in has not been spent to best effect because, for example, we've had record numbers of staff since 2019 coming in, but productivity in our hospitals has fallen. So we're not spending the money that's going into good effect. And why is that? It's partly because we're not giving the staff the kit to do the job. And it's a bit like BA, British Airways, employing more pilots but not giving them planes to fly. And secondly, because if you talk to any hospital manager about the queues of the ambulances out the front door or the 1 in 7 people who are in a hospital bed today who are medically fit to leave but can't because there isn't the care in the community, both of those challenges, the solution lies outside of the hospital with better primary care and community services, things like GP access or support available in your home from district nurses, and indeed social care too. So when it comes to thinking about investment, we've got to link it to reform. And that is the central argument, I think, that Keir Starmer's going to be making today as our Prime Minister. And that's the diagnosis of the doctor. And that's why we're going to write the correct prescription now.
Look, of course, reform is needed. And Darcy points to the reform. You're pointing to the reform. But Darcy also says there is a big funding gap. Health Foundation, £38 billion. You know, 20 years ago, the big improvements in the health service, funding was rising by 7% in real terms between 2001 and 2010. There is no way you can turn the health service around with even the historic amount of money, 3% real a year. And at the moment, on the current plans, it's less than that. Surely the National Health Service, alongside reform, needs a big injection in extra resources next year, the year after and the year after that.
Yeah, so there are three things to say on the money, Ed. Firstly, because of the challenges and pressures in the public finances, not least the £22 billion black hole, we've got to make sure the money that's going in is well spent. And that's why it was right, for example, for me to settle the junior doctors dispute within the first few weeks, because we were paying well over £1 billion on the price of failure when that money could have gone into supporting our junior doctors to treat patients. So that's part of it. Secondly, I think you're right about the challenge right now in the public finances, and the NHS is one of the Chancellor's priorities. I know that, and that's been my experience of working with her in opposition and in government. But of course, it takes time to plug those sorts of holes, and so that's the cautionary note I would strike ahead of the budget and the spending review. We're not going to correct over a decade of failure in the next few months. It's going to take time. And thirdly, for the longer term, one of the reasons why reform matters, and not just in terms of how we spend the money in the NHS, but also how we deal with sickness in our society, because we might be living longer, but we're becoming sicker sooner. If we don't deal with that, we're going to see rising demand, rising cost pressures, and if we're not careful, instead of having a country with an NHS, we're going to have an NHS with a country attached to it, and more likely the NHS going bust. And so that's why it's really important that we deal with the reform agenda from hospital to community, analogue to digital, and crucially from not just treating sickness but preventing illness in the first place, to make sure we've got not just an NHS back on its feet, but one that's fit for the future for the next 75 years.
So I hear you saying that the Treasury needs to understand the National Health Service needs more money now alongside reform. But there's also, Darzi in his report says it's impossible to understand the situation in the NHS without understanding how things are in social care. He says that is dire. That was excluded from the remit of his report. At the moment, the government is saying nothing about funding in social care. Don't you need also to be making the case for extra funding for social care now?
And reform. And look, I know there's deep anxiety in the social care sector, and particularly amongst the families who rely on social care, and especially those unpaid family carers who are carrying a really heavy load at the moment. And we've had some criticism that in the first couple of months that we haven't yet set out what we're going to do, both immediately on social care and in the longer term. Let me just reassure people, I absolutely accept that challenge. And what I'm doing is two things at the moment. One is ahead of the budget and spending review, thinking about what we can do in the here and now and over the course of this Parliament to make sure that we've got social care, helping families, and also helping the NHS to get waiting lists down, because the two are linked, as you say, and also thinking about how we avoid the failure of previous governments. And when I say previous governments, I mean Conservative-led and Labour-led and SNP-led and Liberal Democrats involved too. We've all got plenty of blame to carry. One of the things that's actually been giving me quite a bit of confidence this side of the election, actually, is for all of the rows we've been having with opposition parties on different things. I've now heard the Conservatives, the Liberal Democrats and Reform all saying they want to work with us in a genuinely cross-party way. I really welcome that, and I'm thinking very carefully about how we can do that in a structured way, so we do not just the short-term recovery but the long-term reform we need. But I accept the challenge that people have set us on social care.
Can I ask about the winter fuel allowance, Wes Streeting, because you've just talked about the fact that we're, you know, not just getting older, but becoming more vulnerable. You've just taken a couple of £100 out of the pockets of pensioners earning around £11,500 and above. Back in 2017, Labour Party analysis said that would lead to 4,000 deaths over the winter. Yesterday, Sir Keir Starmer couldn't show the analysis, the new analysis on where you think this will leave pensioners. Where is that analysis and when are you going to publish it? How many people will die as a result of taking that money away from pensioners?
Well, two things. Firstly, the Chancellor will set out the impact assessment for all of her fiscal decisions in the usual way alongside the budget and the spending review. That's how it's normally done. And secondly...
So just to establish, there is analysis which will be published with the budget. You will assess how many pensioners will die as a result of taking away the winter fuel allowance.
Just to draw the distinction between the two things, I'll come to the second part of the question in a minute because it's really important. But on the budget and the spending review, there is always an impact analysis, and the Chancellor will set that out in the usual way. On the second point, let me just reassure people about where we are on winter fuel allowance. And of course, it's still there, albeit means tested. Pensioners will still be better off this winter and will be better off further still next winter than they were last winter, because we have made a political choice to commit to the triple lock, to make sure we've got the warm homes discount and to extend the hardship support too. Energy bills are going up
and you're taking away hundreds of pounds from the majority of pensioners. Those pensioners are not going to feel better off.
But we've also, and I appreciate that, not least because we had to take the decision ahead of the summer in order for the decision to take effect in time to plug part of the £22 billion black hole. I know there are lots of pensioners watching thinking, well, okay, why are we taking the pain? What about everyone else? The winter fuel allowance change raises about £1.5 billion of the £22 billion black hole we've got to plug. There are more painful choices to come. I know that is hard to hear, and the medicine is not welcome, and medicine doesn't always feel good or taste good, but it is a lot better than the alternative of not acting, of not doing the responsible thing by the public finances. As we've seen through reckless choices in the past, we all end up paying a much heavier price down the line. It's not a choice we wanted to make, but we've got to take the tough choices.
It might be the pensioners paying the heaviest price. We look forward to seeing the analysis, although I suspect it will be grim. Wes Streeting, thanks very much indeed for joining us this morning.